Hi, Dr. McCarthy here with Migraine Treatment Success Secret number 3. We've already touched on the topic of the connection between migraine headaches and thyroid. The issue is you've got to get your thyroid tested now. There is a large connection. I've been treating thousands of migraine patients over the past 2 decades, and it's very rare that I find a migraine sufferer who does not have their thyroid gland involved, at least to some extent. It might not be the sole cause, but is one of the issues. And if you don't deal with all of the underlying issues, you're never going to get freedom from this migraine grip that you have. You need to run all the tests, and we've already spoken about this. You have to run all the tests. And typically, in the traditional healthcare provider's office, if you go in and say, hey, can you test my thyroid, they'll run TSH and maybe TSH and total T4. And that's ludicrous. That doesn't tell you what needs to be done. It doesn't tell you what's wrong with your thyroid. We'll run those tests, TSH, but we also run total T4 and free T4. We run total T3 and free T3. We run reverse T3, T3 uptake, free thyroxine index. You need to get all of these levels checked so that you can see exactly what's going on. It gives you the big picture with your thyroid. The next thing that's never very commonly run is thyroid antibodies. If your thyroid problem is an autoimmune problem, that can be what's triggering your migraine headaches. And you'll never know unless you get these tests run. It's real simple. It's a TPO and a TGB antibody test. They're cheap. They're simple tests that need to be done. And it can uncover a whole lot of problems. Then we know that you don't even have a thyroid problem creating your migraine. You've actually got an immune system problem, which is creating your migraines. So how would you know unless you have the tests run? We've mentioned previously that there's 2 different halves to your immune system, Th1 and Th2, and we check to see what the balance is. If one side is dominant or the other, we've got to figure out why. We've got to remove that, and then we've got to allow your body to balance its own immune system. We look for what's called an active antigen. There's lots of different things that can present as an active antigen inside your body. Parasites, bacteria, viruses, foods, food sensitivities can create this imbalance in your immune system. How do you know if you have that if you haven't had the test done? Other things that can affect the way your thyroid functions, thus perpetuate this migraine situation, are hormone imbalances and blood sugar imbalances. And if you don't have these things properly evaluated, really you're just guessing. So instead, you're going to take pills to cover up the symptoms of your migraine headache, and you can already see how successful that's been for you. Don't suffer another minute with migraine headaches. Call my office now. Thanks.